being born prematurely, being of non-white ethnicity, and being obese very, very slightly increased your risk of severe disease. But not so much that we would have wanted to change the headline message that overall COVID is not causing a large amount of severe disease in children. And that leads avenues to research to try and understand why is it that children are not getting severe disease. Because with influenza, another very nasty virus, children suffer dreadfully badly. So we need to understand what are the differences there. So there's two issues here. There's the public health message that kids can go back to school and they're not at harm themselves. But also there's something interesting going on with the science that might lead us to better understand this disease.
But of course, a lot of people are concerned, this might not have been part of your study, but concerned about the capacity of children to spread the virus. What could you say about that?
It was not part of our study, but it has been the work of others working throughout the world and in England. And on the whole, the evidence is that children probably transmit very slightly less than adults, and certainly less to each other. If anything, the risk is from adult to adult and adult to child. So again, quite reassuring data, but coming from other groups.
Children are going back to school now, they're going to be in contact with others. What symptoms should parents be looking out for if they're concerned?
Well, this is where it gets really tricky, because the symptoms are not distinguishable from any of the other respiratory viral problems. And kids are going to be picking up flu and rhinovirus and respiratory syncytial virus, the more common viruses. And these are going to cause coughs and fevers and sneezing and runny noses, and sometimes diarrhea and vomiting. Unfortunately, there's no easy way to distinguish on symptoms the difference between COVID and other respiratory pathogens in children. So if your child is sick, you should keep your child off school. And if your child is very sick, you should be seeking medical attention, because chances are it's not actually COVID that's causing the disease. It may be something else. The child may have caught a pneumonia from another organism and would still need medical treatment.